So once again, thank you everybody for joining in the talk today. I will be talking about decoding dementia, talking about more facts, more of factual knowledge about dementia, because I find that there is a lot of misconception, there can be a lot of misunderstanding on this topic. And it is a topic that I am personally very interested in ever since I worked in the psychiatry department. And on top of that, I will be talking about ways to manage and to help the loved ones that we have who might be going through this difficult time. So to begin with, I'll first talk a little bit about alpha cell because of where Mr. Pei left off earlier. I will be talking about alpha cell. So what is alpha cell? Alpha cell is actually the world's first combination of stem cell, high electric potential, and exosome therapy together. And this why do we choose such a combination? It's because it actually maximizes the regeneration and repairing effect of the stem cells rather than just taking stem cells alone. We recognize that the combination of these three components are actually produce the best outcome. So electric potential therapy helps to promote blood circulation and enhances deep sleep, whereas exosomes act as a booster for the stem cells that already exist in our body. So just for a little bit of background on what actually are stem cells. Some of you may have heard of it before, but for the benefit of those who have never heard of it, or just a little bit of a refresher, stem cells are actually our body's raw materials. They are actually cells from which all other cells with specialized functions are generated. So at one point, every single cell in your body actually came from a stem cell. So imagine the potential that stem cells actually have. No other cell in the body has this ability to generate new types of cells apart from stem cells. And stem cell therapy, which is also known as regenerative medicine, promotes the repair response of disease, dysfunctional, or injured tissue using stem cells. The picture over here on the right is actually how stem cells look under electron microscope. And on top here, stem cells, as you can see, are capable to renew into various types of cells, including connective cells, which actually help in our joint, our bone functions, cartilage cells, of course, in our joints, white fat cells, also called adipocytes, and even bone cells. And these are just a few types that they can differentiate into. So how many stem cells do we actually have? So as you can see from this table, as we grow older, from being a newborn up to a person of 80 years of age, our stem cells gradually will reduce as time goes on. Why does this happen? Because stem cells are actually used up by the body to repair all the places that it needs to repair. And even the existing stem cells that we do have will start to get older as well. As we get older, the stem cells get older, their function starts to reduce, it starts to slow down. So what happens when all these natural processes set in? What happens is we will face a situation where there is less regeneration of our cells, less cell repair, and that's why a person actually becomes more prone to illness as they get older. There's also longer healing time. Maybe in the past, if you have a slight ankle sprain, when you're younger, the next day you can walk it off, you can be active as you usually are. But when you're 50 years old, this is no longer the case. Simple sprained ankle may take weeks to recover, all because our stem cells have reduced in number in the body. And of course, it also contributes to our outward appearance as well, because when we are not healthy on the inside, it does show on our outward appearance. So we start to look a little bit older as well. So there are actually two types of stem cells, broadly speaking. HSCs, also called hematopoietic stem cells, and MSCs, which we are more interested in, called mesenchymal stem cells. HSCs, on the left over here, these are stem cells that develop into all types of blood cells, including red blood cell, white blood cell, and platelets. These are found in our bloodstream, and our bone marrow as well. And they are also called blood stem cells. So when you hear people saying that, oh, I am saving a bit of my child's umbilical cord, what they are actually saving is this hematopoietic stem cell in case the child should need it in the future for things like leukemia. What we are more interested in is mesenchymal stem cells over here on the right. These are multipotent cells, meaning to say, besides blood cells, they can actually differentiate into every other cell you see on this diagram, including fat cells, nerve cells, liver, muscle, heart, bone, cartilage, you name it, it can differentiate into these types of cells, and therefore it can help to repair damage in our body that we might not even know existed. So where do stem cells actually come from? So when a sperm and an ovum fuse together, it forms a zygote, as we all know. And after the zygote forms, it multiplies, the cells inside multiply, and it forms an embryo. At this point, it's actually called totipotent cells. Okay, so at this point, this is not what we are more interested in. As it continues to reproduce, it produces this blastocyst and then an embryo. All these here are pluripotent cells. This is what we do not take and we do not use simply because these are unborn babies. And of course, it's controversial, it's prohibited. This is not where we take alpha cell stem cells from. Where we take alpha cell stem cells from are actually over here. This is the umbilical cord. After a baby is born healthy, we actually take our alpha cell stem cells from this material surrounding the umbilical cord called the Wharton's jelly. Wharton's jelly, when the baby is still in the womb, the Wharton's jelly acts as a cushion to protect the umbilical cord. But once the baby is born healthy, essentially it is considered medical waste. So this is the part that we are interested in. Why? Because Wharton's jelly is very rich and very high in mesenchymal stem cells. They are very easy to harvest. And of course, there's no ethical issue because the baby has already been born and they are already healthy. Our MSCs come from young consenting donors, women aged between 18 to 40 years old after they give birth normally. All tests are within normal limits. They are screened for all autoimmune disorders, chronic illness, infectious illness, and they are rejected if there is even any family history of hypertension, heart disease, malignancy, and any genetic disorders because we want to ensure the highest quality of stem cell. So these are two studies that have been done proving that Wharton's jelly actually contains a very high amount of mesenchymal stem cells, which is why that is where we harvest from. So this is a little bit to highlight a little bit about our manufacturing process. Once the umbilical cords are harvested, they are packaged and collected from the operation theater directly to our CGMP certified facility within 4 hours. From there, they extract out these stem cells, and then we start to manufacture. They use a certain staining method called Tryphan blue, which actually picks out only the healthy cells and then dispose of the unhealthy cells. We use a cytometer, which is a type of computer to count the number of stem cells. And of course, again, there is another round of sterility testing to make sure that there is no bacteria, virus, fungus, and so on. They are also ensured to be free from fungal contamination. And only once all this testing has been passed, then the stem cells are allowed to be brought out from the lab and used by our clients. These are some of our CGMP certifications, including our clean room. This one over here is renewed every year. These are our manufacturing licenses and our halal certificate as well. So why do we choose MSCs? First of all, there's a very strong differentiation capacity, meaning to say that MSCs are very young and they are able to change into a lot of other different types of cells. Apart from that, there is no risk of rejection simply because stem cells are immune privileged. Now, immune privilege means that our body does not recognize stem cells as a foreign invader, and they do not mount any kind of rejection or inflammatory responses. And the third is that there is an immunomodulatory effect. So this means that it is especially useful in cases of autoimmune disease, such as lupus, rheumatoid arthritis, because it reduces the chronic inflammation brought on by autoimmune disease. As I mentioned, stem cells are, mesenchymal stem cells are multipotent. So these are all the types of cells it can develop into. Now let's talk about our main topic for today, which is dementia. So you might have heard of dementia before, but what it actually is an umbrella term, meaning to say, when we say dementia, there are actually many different types. So it's an umbrella term used to describe brain disease and their symptoms. So what kind of brain disease? Memory loss, okay? Impaired judgment, changes in personality, and most importantly, being unable to do their daily activities. So this includes things, simple things that we take for granted every day, like feeding themselves, taking showers on their own, brushing their teeth, basic hygiene. All these things start to get very difficult when a person has dementia. So since this is an umbrella term, let's talk about what are the types of dementia. So as you can see from this big umbrella diagram over here, at the bottom here, the first one is Alzheimer's disease. Alzheimer's disease is one of the most, it's actually the most common type of dementia, and probably the one that most of us have heard of, okay? So there's, the prevalence is about 60 to 70% of all dementia cases. And what you can see on histology, meaning to say when you take a microscope, look at the brain, there are these amyloid plaques and beta tangles, which I will talk about later on in the slides. And there's impairment in memory, language, and visual-spatial skills. Now, the second type of dementia is called vascular dementia. What is vascular dementia? It is basically when there is disease or injury to the blood vessels in the brain. For example, in people with stroke. Ischemic stroke, meaning to say there's a lack of blood supply because of a blockage to the vessel, or hemorrhagic stroke, when the BP, blood pressure is slightly too high and there's a little bit of bleeding in the brain. So anything that interferes with the brain's blood supply can lead to vascular dementia. So over here, the symptoms basically will look like impaired motor skills because, again, like in a stroke, there are certain parts of the brain that has already been damaged, and of course, impaired judgment. The third type over here is slightly more rare, I would say. It's not very common. It's called frontotemporal dementia. Now, our brain, actually, there are various lobes of the brain, the frontal lobe right in front and the temporal lobe at the sides. So frontotemporal dementia is when there is injury or deterioration of the front part and the sides of the brain, which is where memory is supposed to be formed. So in frontotemporal dementia, you will classically see personality changes because our frontal lobe is responsible for our personality. So you will see them start to get very angry, they are not themselves, right? Maybe a person used to be very calm, currently now throwing tantrums, things like that. The fourth is called Lewy body dementia. This is even more rare. It's only 5% of dementia cases. And over here, people start to have hallucinations, meaning to say they see and hear things that are not there. Voices, seeing things, right? Difficulty in sleeping, impaired thinking, and of course, the motor skills are affected as well. And then at the very last, we come to this last category called other dementias. And over here, it's also 5% of dementia cases. So these ones are all the other very rare dementias like Parkinson's, Huntington's disease, which is familial. HIV infection can also lead to dementia, yeah? And something called Creutzfeldt-Jakob, CJ disease, and Korsakoff syndrome, which is when there's too much alcohol consumption that can also affect the brain and cause dementia. So among all of these types that we talked about, the most common is Alzheimer's dementia, which accounts for 60 to 70% of dementia cases. And I'm not sure if you're aware, but Alzheimer's Awareness Month was actually celebrated just last month in June. Okay, so that's a very good time for us to consider learning more about the disease and making maybe a donation, things like that. So basically, Alzheimer's dementia is a progressive disease, right? Progressive disease meaning to say it just gets worse and worse. So it begins maybe with a mild memory loss. Eventually, it will lead to a loss of ability to carry out a normal conversation and respond to the environment. Alzheimer's disease actually involves parts of the brain that control our thought process, our memory formation at the side, and our language skills as well. So after a while, they are not even able to talk to us and tell us what they want. So as you can see from this diagram, this is what a healthy brain should look like, nice and big, right? With all the neurons supplying it like this, okay, nerve cells. And then in an Alzheimer's brain, can you see that it's smaller, right? There's a general shrinkage of the brain, and there are these plaque formations, which I'll talk about in a minute. Plaque formations, which is deposition of toxins. So that is why you can see here all these so many nice networks, and over here everything is gone. So this is what happens to a person when they have dementia, Alzheimer's dementia. So let's talk about how does it happen, because everybody is very concerned, like why does this happen actually, right? So Alzheimer's disease, it's actually characterized by amyloid plaques. So there's this extracellular, meaning to say outside of the cell, there is amyloid, beta amyloid deposition. Beta amyloid is a type of toxin, all right, that the brain is supposed to clear out via something called the glymphatic system. Same like how our body has a mechanism called the lymphatic system, the brain has a glymphatic system that helps to drain off these unwanted toxins. But in certain cases, especially like in Alzheimer's disease, it starts to build up. And when it builds up, it forms things called senile plaques, which is over here in the blue part, amyloid plaques. They start to form up. So you can imagine a sticky, tangled mass, right, which is insoluble. And there's the second thing is an abnormal accumulation of a protein called tau protein, which collects inside the neuron. So these are the main two ways that Alzheimer's forms: amyloid beta deposition and tau protein. Over here, it forms these tangles, okay? And of course, there is increased inflammation in the brain, because when there's so many toxins, obviously your brain is going to start to get inflamed. So when there's inflammation, all our symptoms start to show up. So there's neuroinflammation, mitochondrial dysfunction. So this one over here means that there is less energy production in the brain. So as you can see over here, under a microscope, a normal brain should look like this: healthy neurons. Okay, so the neurons are the ones that transfer information over in the brain. Whereas in an Alzheimer's brain, there starts to be this amyloid plaque. Remember, I said earlier, extracellular deposition. So it forms outside the cell. And then these neurofibrillary tangles, which are inside the cell. So all these together, outside, there's a problem outside, there's a problem inside as well. So this one is under a microscope. But what do we see with the naked eye? You see here, our healthy brain is this big, whereas an Alzheimer's dementia brain looks like this. It looks like it's starting to get collapsed. So the brain volume will shrink. See, shrinkage of cerebral cortex, and large ventricles over here because there's bigger space. And the hippocampus, which is our memory center, will start to shrink as well. That is why they can't form new memories. But Alzheimer's patients, typically they remember things from long, long ago. But if you tell them something maybe 1 or 2 days ago, they won't be able to remember it anymore, right? This is because of the shrinkage of the hippocampus over here. So why is this so important to us especially, right? Because as Alzheimer's cases climb, experts actually project that the condition will triple among Asians by 2030. Isn't that a very, very scary statistic? Because a lot of, in the past, a lot of people believe that Alzheimer's, or it's a Caucasian person problem, white people problem. Actually, no, because you see here, within the Asian community, it is projected to triple in prevalence. And why is that? It's because of diabetes. There's actually a very strong link between diabetes and Alzheimer's. And Asians, especially South Asians, are 4 times more likely to get type 2 diabetes if you compare with other ethnic groups. And a study in 2021 shows that the younger you are at the time of your diabetes diagnosis, the higher your risk of having dementia after you're 70 years old. And because of that, I do think this is a problem that affects us all. Okay, so what are the signs and symptoms of dementia? Okay, how do we know if somebody, one of our loved ones, or maybe we ourselves, how do we know that this is dementia, this is a problem? Okay, so first of all, as I mentioned, problems with recent memory. So they are unable to form new memories. They can't remember what happened last week. They can't remember what happened a few days ago. Okay. Second, there could be problems with their visual perception. The vision might be impaired as well, not seeing as well as they used to. And then you start to notice changes in mood. maybe in the past, very happy-go-lucky, very calm. Suddenly, everything also, they get very upset. They get very upset. Their behavior starts to change. Okay, maybe becoming a little more childish. This is not really a normal part of aging, because a lot of people will say, oh, when people get older, they start to act like children. Not really, no. It could be a sign of dementia, that their behavior starts to get more childish, their personality starts to change, right? And then they could also start to be problems with walking and mobility, because sometimes when there are certain parts of the brain that are affected, it can actually cause motor problems. So walking, mobility, yeah. Maybe they start misplacing things. Okay, so they start forgetting where they kept their things and then getting very upset when they can't find it. So these are some of the signs of dementia as well. Starting to get confused with places and time. Maybe you find that they wander out, they cannot find their way back home. This is very classical. Difficulties in planning and thinking, because this is part of the frontal lobe function at the front of the brain. So they start to, when you ask them what they want to do, they cannot tell you because they cannot plan, right? They cannot think for themselves. It's very difficult for them to formulate. Difficulties in communication. They possibly know what they want, but they cannot tell you. And then when you don't know what they want, they start to get upset. So this is one of the signs and symptoms of dementia as well. And then, of course, poor judgment and impaired social behavior. So things that a normal, healthy, younger person wouldn't do in public. Embarrassing things, for example, they don't seem to realize that they are doing, they don't care. So this is impaired social behavior. And of course, difficulties completing familiar tasks, things that they used to know. Maybe you think, oh, all this while, this person can cook very well. Why suddenly can't seem to do it anymore? These are familiar tasks that they find difficult to complete. So these are all the signs and symptoms, possibly signs and symptoms of dementia. But apart from dementia, you might be thinking, okay, this person that looking at these signs and symptoms of dementia, okay, this person that I know, they don't really have something like this. It's not so bad, they don't really have any of this. But I still don't think that they are 100% how they used to be. There is something wrong. I feel that there's something wrong. Then comes this mild cognitive impairment. So mild cognitive impairment, or MCI, this is actually a condition characterized by a minor decline in mental abilities, okay? So it's a minor decline. Often these changes are noticeable to the person who has them or to the family members or close friends. But, and here's the difference, they don't interfere. They are not severe enough to interfere with the normal daily life and activities. So maybe this person can still kind of do what they used to do, like maybe can just shower on their own, can still go out on their own. But you can clearly realize that there's a decline in the mental abilities. Okay, so this is called mild cognitive impairment. And according to the Alzheimer's Association, 15 to 20% of people aged 65 or older actually have this MCI. Okay, so how do we know if it's MCI? These are some of the symptoms. First of all, memory loss, forgetting certain words. When you're talking, right, you suddenly think, hey, what was that word? I just can't place it, can't think of it. So that's something like memory loss, okay? Forgetting important events like appointments. All this while you can remember your appointments very clearly, suddenly you find it very difficult to remember. Losing your train of thought in conversation. You're talking to your family member about something. In the middle of the conversation, you suddenly forget, hey, what was I trying to say? Or reading a book and then suddenly realizing, hey, what am I trying to read? Or maybe even watching a movie and suddenly realizing you can't understand what's going on. Becoming disoriented in familiar surroundings, like, hey, where am I? Even though it's somewhere you already knew. And becoming more impulsive, doing risky things that in the past you normally wouldn't do. Maybe driving very fast, right? Or being more reckless in your shopping decisions. You are spending more than you used to. These are some of the signs of mild cognitive impairment. And why this is important for us to know is because studies have shown that 10 to 15% of people with MCI do go on to develop dementia every year. Yep. So even though you might think, oh, this is just a small matter, I only have MCI, it's not dementia. But the problem is that 10 to 15% of people with MCI can go on and do go on to develop dementia every year. So coming to the treatment aspect of it, of course, the most common and the one that we always hear of is medication, right? Now, medication is not without its drawbacks. The problem with medication is that most people with dementia don't think they need it. How are you going to tell an adult, please take this medication? And he tells you, I don't have a problem. Why do you want me to take medication? That is one thing. The second thing, of course, is that there are side effects to every medication we take. And dementia medication is no different. So now in recent years, we have started to look at stem cell therapy as an emerging treatment modality for Alzheimer's dementia. As you can see from this diagram, stem cell treatment for Alzheimer's, what happens when, okay, so over on the right side is the Alzheimer's brain, right? We saw earlier it shrunk, right? There are all these neurodegeneration, right? So once the brain is treated, what the researchers saw was that there are regeneration of neurons. So all these purple cells start to regenerate. There's improved memory and behavior, and of course, an improved quality of life once they administer stem cells. So on a molecular level, how does stem cell actually help with dementia? First of all, that is why I tried to explain how does dementia actually form? Why does a person get dementia? Because that's what is very crucial for us to understand. So we knew that there's a amyloid beta plaque, right? So stem cells actually stimulate enzymes to break down and degrade all these amyloid beta plaques. And thus it contributes to reduction of the hippocampal amyloid beta plaque. So the hippocampus, as I said earlier, it's the memory center. So when the plaques in those areas are broken down, the memory center starts to be healthier. It's able to regenerate, it's able to start to form memories again. Second is immunomodulatory actions. It actually speeds up the activation of microglia, which are tiny, tiny, tiny cells in the brain that help to remove amyloid beta deposits in the brain. And of course, remember earlier on, we saw there's a lot of inflammation going on, right? So stem cells are able to reduce all that inflammation within the brain. And that is how it helps with the dementia part. Okay, as I mentioned, anti-inflammatory effects. The levels of these inflammation markers like interleukin-10, tumor necrosis factor, all of these are involved in inflammation process and cancer. Studies have shown that they actually decrease after a person was given MSC therapy. There's inhibitory effect on apoptosis. What is apoptosis? Apoptosis is actually programmed cell death. All of the cells in our body actually have a time of lifespan, right? They're going to die eventually. So the brain cells are no different. They will also eventually die, okay? But MSCs are able to help the cells survive longer. It boosts cell survival signals. It produces growth factors for the nerves and blood vessels, and therefore the brain cells can actually live longer, all right? And it prevents them from dying before they are supposed to die. And of course, neurogenesis. Neurogenesis basically means that there are new nerve cells being formed in the brain after a person is given mesenchymal stem cells. And it doesn't have to be, you might be thinking, oh, do we need to inject it directly into the brain? No. Studies have shown that even given intravenously, just like how we give alpha cell intravenously, studies have shown that these stem cells are able to migrate and reach the brain at the site of injury, where they can differentiate into neuron-like cells. And they can also express choline acetyltransferase. This is a neurotransmitter. So when there's this neurotransmitter, the brain function improves. And that is how scientifically stem cells are able to help in Alzheimer's dementia. In fact, it's not just something that we are talking about here. It is something that has been extensively studied. Multiple studies have been done already. So over here on the left, a review done from 2017 all the way to 2022. So you imagine this is actually a 5-year time period where they reviewed how stem cell actually help with Alzheimer's. And they did show that, all the points that I mentioned earlier were found from this study. In addition, the Alzheimer's Society itself, okay, in the UK, it actually supports the use of stem cell research to understand the causes of dementia and to find new cures, okay? So over here, a study done in 2017 for Alzheimer's, dementia, and stem cell therapy. Over here, we have a study done in 2022, as recent as last year, also showing a review of how stem cell therapy helps with Alzheimer's, dementia, and Parkinson's dementia as well. So over here, I just summarized it, okay, because the study is many, many pages long. But essentially, in summary, based on all these studies that have been done, stem cells are actually a very, very safe and viable therapeutic option for people with Alzheimer's dementia. It definitely improves their cognitive function, it improves their quality of life, because everybody has to go through aging one day, and inevitably some people get sick. But it's just a matter of our quality of life is very, very important. So apart from the dementia aspect, as you can see over here, all right, stem cell therapy helps in a lot of neurodegenerative disease, even things like stroke, traumatic brain injury, dementia, and so on. But I want to draw your attention to this part. It is a treatment to reverse the loss of cognitive function and improve memory. So why is this important? Remember earlier we talked about mild cognitive impairment. Okay, so certain people that you know might have MCI, mild cognitive impairment. It's not so bad. It's not dementia yet. But stem cell therapy can even help in MCI because, as it says here, it can reverse loss of cognitive function and improve memory. So stem cell therapy is useful for MCI where the symptoms of Alzheimer's have not yet set in and are not yet severe, because we wouldn't want to wait until it turns into dementia and then only start to find a way to treat it. So this is how it can help in MCI itself. So now that we know what causes dementia, we know what the signs and symptoms are and how we can treat it, let's talk about reducing your risk for Alzheimer's itself. Now, according to the US CDC, there's evidence that people who adopt healthy lifestyle habits like regular exercise, manage your blood pressure well, all these things can actually lower your risk for dementia. Essentially, a very common saying goes, what's good for the heart is good for the brain. So you imagine what is good for your heart? Exercise, right? Aerobic exercise where your heart needs to pump, you need to sweat. All these things are good to prevent dementia. It's good for the brain, okay? So exercise can prevent the cognitive decline. Diabetes, if at all a person has diabetes, it definitely has to be well controlled. So if your doctor is telling you, oh, for the diabetes, you might need medication to control your blood sugar, by all means, you should take a little bit of it. Take it under advisement, because if your diabetes is well controlled, your risk of Alzheimer's is reduced. Obesity. So for those of us who are obese, it would be better to try to reduce your body weight, bring it down to a normal BMI, because that also can help with reducing your risk of Alzheimer's. Things like traumatic brain injury can also increase the risk. So for example, things like an accident, right? Hitting your head. So be very careful when you walk, be careful not to fall, not to have any kind of injury to your brain. Your brain is very precious, right? Tobacco and alcohol also increase the risk. So for all the smokers and people who consume alcohol, try to reduce your consumption of these two substances because they definitely increase your dementia risk. Remember, what's good for the heart is good for the brain. Sleep is directly linked to Alzheimer's. And this is very interesting because remember earlier I talked about the glymphatic system. The glymphatic system drains out beta amyloid and toxins from the brain. The glymphatic system is actually only active during sleep. So for people who stay up till 3 a.m., 4 a.m., not sleeping enough, you might feel okay now, but you are putting yourself at a higher risk for Alzheimer's in the future. So definitely look into your sleep quality. And the last is social engagement. Social engagement basically means having a healthy social circle of friends and family, socializing, because studies have shown that elderly people who live alone and do not interact with others actually are at a higher risk for Alzheimer's. These are some of the support groups in Malaysia. So you can see here, there's the National Dementia Caregivers Support Network, okay? This one actually helps caregivers to come up with coping strategies, right? And basically it's a support group. Nobody can do this alone, all right? It's very challenging managing people with Alzheimer's. So if you need help, if you find that you need someone to talk to, do reach out to this Dementia Caregiver Support Network. And then in Penang, there's the Penang Dementia Association as well. So this concludes my talk for today. Thank you so much for your attention. I will now open up for a Q&A session.
Wow. Thank you so much, Dr. Karen. Isn't it such an informative and interesting talk by Dr. Karen? A very complicated problem, but make it very simple, Dr. Karen. Yeah. So today also I learned about MCI, not just dementia. So I guess all of us must look out for all these symptoms when we are still young. Even don't live until when you are too old to realize that we are on the way to dementia or MCI. Okay, now the room now is open for Q&A. Anybody has question can now type in chat room and then we can now address to Dr. Karen. So there's somebody asking, Veronica asked about what type of supplements prevents dementia?
Okay, that's a very good question. In terms of supplements that directly prevent dementia, I would say there isn't one that is quite so perfect lah. All right. However, you can take supplements indirectly to help to reduce your risk. Remember earlier on, I said what's good for the heart is good for the brain, right? So things that are good for the heart, for example, like getting enough omega-3, omega-6, okay? So normally we see that in fish oil capsule, for example, right? Getting all these omegas ensures that your heart is healthy, and that's how it can help to reduce your risk of Alzheimer's. But actually there is no supplement that will directly prevent completely, right, your risk of dementia, but some supplements certainly can reduce your risk. Yeah.
Okay, good. Okay, another question from
Head and hand shaking.
handshaking. Yes. Is
Okay.
it a symptom of handshaking and head shaking?
Okay.
Is it a symptom of dementia?
Okay. Head and hand shaking. Hand shaking is tremors, right? So tremors are quite okay. It can be something very benign, meaning to say even normal people have it. Like for example, if your muscles are slightly tense, right, or you're tired, they can be very, very simple explanations for hand tremors. All right. It is not necessarily a sign of dementia because things like head and hand shaking is quite general. So I might need a little bit more information than that in order to really say if a person has dementia or not. But typically for people with Alzheimer's dementia, we don't really see a hand tremor. It's relatively rare. Hand tremors are more common in Parkinson's dementia or Parkinson's disease, okay? But even then, normally it has to diagnose it to, let's say we want to diagnose a Parkinson's disease, right? It's not only the hand tremor, there will be a lot of other criteria to fulfill. But if it is something you are worried about, definitely speak to your GP or your doctor about it because they can help to take a more detailed history from you, right? And then try to come to a solution, try to come to a diagnosis of what you are going through. But if you say directly the hand and the head shaking, it's not very likely to be Alzheimer because again, the most important here is cognitive decline, loss of memory, loss of function. That is the most common that we see in dementia. Yeah.
I see. So Veronica asked again, what about B complex? Does it help in dementia?
Okay, so for B complex, right? B complex is definitely very important for all our cell functioning, cell repair and regeneration, all of these things. It can definitely help to maintain your health status. So I think it is a good idea to take some B complex, or if you don't want to take a B complex, definitely more natural foods that are high in vitamin B. It can help to maintain your health status. And if you keep yourself active and all this, yes, it will reduce your dementia risk. You can.
Right. And Thomas asked about, will kids or children or young age people get dementia nowadays?
Okay, dementia is commonly in people above 65 years old. It's a problem in the aging population. So no, children, young age people do not get dementia. When we are talking about Alzheimer's dementia, yeah, Alzheimer's dementia primarily affects people above 65 years old. So that also answers your first question. Malaysian average age getting dementia, normally it's above 65 years old. All right. kids and children or young age people who get dementia could be things like frontotemporal dementia. So that's not the Alzheimer's that we're talking about. It's another type of dementia that is possible.
You see, does woman or man has higher chance of getting dementia?
Okay, typically I would say men. Okay, men. Reason being, first of all, women have a lower risk of things like cardiovascular disease because of the estrogen, right? So when the heart is healthier, of course, the brain is healthy, the vessels, the circulation, everything is healthier. And typically, the percentage of smokers and alcohol consumption is higher in men, typically, right, in the Asian population. So men do have a slightly higher risk of dementia, but both men and women can get it.
I see. So I have a question, Dr. Karen.
Yes.
So from the sharing just now, we talk about we will worry about dementia. We should worry about dementia coming after age 65. So, but what is your advice, doctor, that at what age, starting from what age, should we take measurement to help us to delay or avoid getting dementia?
Yeah.
What should we do, and at what age?
Okay, of course, the earlier the better. There is no such thing as too early for prevention for any kind of illness, right? Especially something as terrible and as bad, horrible as dementia. So I would say definitely, okay, remember early on we saw when does your stem cells start to decrease? Normally when you are 30 and above, your stem cells start to have a very sharp decline. So you already know that your regenerative ability is getting poorer. You already know that you are at higher risk for all illness. Typically, people above 30 start to get illness already. High cholesterol, right? It's not unheard of, especially in our current day and age, right? So definitely when you're 30 and above, it's safe to say that is when you should start to take preventive measures already. Take care of yourself.
I see. Okay, so there's never too early to do the prevention.
Never too early.
Yes. So Thomas asks, city people will compare to village people, do they get dementia earlier? City people versus
Okay,
village
so for
people.
this one, right, I didn't actually particularly look at a study in terms of city people and outskirts rural areas, right? But simply because it is quite a niche question you're asking. But typically, if you think about it, are city people or rural people more sedentary in their lifestyle? I would say city people, right? We work office jobs, we don't really get out compared to village people who do a lot of farming and a lot of physical activity. So I would say the risk of city people living sedentary lifestyles to get dementia is definitely higher compared to village people. Yeah.
Definitely. I see. So it's not about whether you're living in city or in the village, but
correct.
what kind of lifestyle we practice, right?
Yes, correct.
Okay.
Can dementia
Then,
patients recover after going through stem cell therapy? If yes, is the
yes.
treatment one-off? Okay. All right. So earlier on, based on my slides, I did show the mechanisms and how stem cell is able to help in dementia, right? By breaking down those plaques, by reducing inflammation. Okay. So, okay, in terms of recover, we would, number one, have to see how severe the dementia is. If it is a person who has dementia for 10 years compared to a person with dementia for 1 year, of course, the outcome for the shorter duration of illness is definitely going to be better, right? Okay, so the severity is very important. Whether or not a person recovers really depends on the severity, all right? I wouldn't even say recover. I would say if it improves to a point where they are able to have a better quality of life and target symptoms, because normally for any illness, we have something called target symptom. We want to know what are we treating. For example, let's say a person with dementia can't even feed himself or go to toilet anymore. After receive stem cell, he can do these things by himself. Family will already be very happy. Client will be happy, right? So I would consider that a win already, because it's very individualized, it's very personal. We need to sit down with the person and try to come up with what are the goals we hope to achieve from the stem cell therapy. If yes, is the treatment one-off? Let's say if it's not very severe, after one injection, right, one stem cell injection, the person feels, okay, all these functions are recovered, I feel much better. then of course that's very good. We won't have to think about when is the next one, right? But let's say after one round of stem cell injection, they feel better, and the next year they feel that, okay, since I already feel better, I want to maintain this current health. I want to maintain my condition. Of course, they can always take another round of stem cell. Aging is inevitable. The brain is going to still degenerate slowly, but stem cell will reduce the impact of the Alzheimer's, okay? Reduce the rate of degeneration. A person definitely has to get older, but once the stem cell is given, they are able to live healthier lives and improve their quality of life. So I don't really see it as recover completely, but I see it as a big improvement in their quality of life and helping them to live better despite illness.
Yeah. So any statistics show that taking alpha cell recover the dementia? So
okay, of course, like I said just now, recovery is a very arbitrary term, right? It's not one person's definition of recovery might not be the same as another person, okay? But we definitely do have some clients with dementia who have taken alpha cell and saw good results. Of course, I cannot say who because of, I cannot show all these because of privacy for client confidentiality. It's of course very important to us here at Alpha Cell. But yes, there's definitely clients of ours who receive stem cell and there is very big improvement in their dementia condition. Yep.
We have Dr. Ko asking any diets that can help in dementias.
Oh, okay. So a heart-healthy diet, definitely very important. So less oil, things that less saturated fat, right? And of course, earlier on, we talked about supplements like omega, B vitamins, all these can help as well. I would say a low-fat diet, okay? And less sugar as well, because earlier on, we saw obesity and diabetes can cause worsening of symptoms of Alzheimer and increase your risk. So definitely need to take care of that. So low sugar, low fat, right? Low calorie, basically only what your body needs.
Anything that makes hearts healthier makes brain healthier. Is that right?
Yeah, exactly.
So will dementia, getting dementia, was it affected by family health history?
Yes, there's definitely a genetic component to it. Okay, so people with a family history of dementia have a higher risk, definitely. Yeah.
Okay.
Will
So
taking
Wayne asked
statins
about taking statin increase the risk of dementia.
increase the risk? Okay, taking statins typically is for people to reduce their cholesterol level. Okay, so if it reduces your cholesterol level, it actually helps to improve your body's condition. So it doesn't actually increase the risk of dementia. Yeah, it shouldn't increase the risk of dementia. Yeah.
Okay, the last question. So tonight, which type of people easier
to get dementia? Oh, okay. Obese, all right. People with chronic illness, diabetes, hypertension, past history of stroke, all of these chronic illnesses, okay? All of which, by the way, can be controlled and treated with stem cell as well, yeah? So all these people with all these conditions definitely have a higher risk of dementia. So receiving stem cell to help to control these other parts, not only helps your health condition become better, meaning to say controls this illness, it will also reduce your risk of dementia. Okay, so these type of people. Yeah.
Okay, I know they have a question pouring in. Dr. Karen, you have addressed so many questions. So interesting talk. I think because due to time constraint, I may have to stop the questioning right now. And those who still have questions, you can still continue to type in the chat box, and then we will pass the question back to Dr. Karen, and Dr. Karen will revert to us, and then we'll come back to you. If you can leave your contact number and also post the question. You can also post the question to the person that invited you to join this Zoom talk. Okay. So thank you so much, Dr. Karen, for your sharing, interesting sharing.
Thank you.
And